Every time I was just searching on the internet about the surgeon, about the doctor, about the chronic pancreatitis. So one day, like a miracle happened. It's like it's literally just not the video, but it's just a miracle happened in my life because probably I have to live a bit more longer. So I found him. Seriously, I found him. I came here and everything went so smoothly. He's so skillful. He's brilliant. In simple words, I want to say that he's simply the best in the world. Seriously.
We're so happy with the
We're
operation.
so happy. And it is not like I had the surgery, like this is my 4th day. I came down from my room by myself, walking down by myself, and I'm not feeling any kind of pain. And I'm very much happy.
All the international patients really recommend this
Would
place.
highly recommend this place, highly. Just come to Dr. Amit Javed if you have any problem regarding abdominal issues and like that.
Hello friends, today with me I have two young ladies that have come all the way from Australia to get treatment for their chronic pancreatitis. So she is the patient who lives in Australia, and this is her friend who is actually from Kenya, Nairobi, and she is settled in Australia. So you came all the way from Australia?
All the way from Australia
to
just
New
to
Delhi,
get
India?
From you.
Okay.
Yeah.
So can you tell us about your disease, this chronic pancreatitis? How long back did you get to know about this disease? What were your symptoms? Did you go to any doctors in your country? What were you told? How did you reach us? And what was your experience when you came here?
Okay, a little bit about my history, that how I get to know about my disease, that I'm having the chronic pancreatitis. I got pregnant a year back with my 2nd child, and I got the gestational diabetes during my pregnancy. And then I was getting the insulin during the pregnancy. However, the pregnancy and the delivery went well. But after that, I observed that a slight pain on my right side of the stomach start coming out. And then my gestational diabetes, the overall HbA1c was not getting lower. It was not much high, but of course it was higher than the normal value. So I went to my GP and she had some blood test. And during that blood test, the liver values, some of the liver values were high, like AST and ALT. And she told me that you have a fatty liver, not much, but slightly. So it's better you go for an abdominal scan. So then I go for an abdominal scan, and during the abdominal scan, the technician told me there, I'm guessing that there is some stones over there on the right side, but we are not sure. Probably it is in the gallbladder or in the pancreas. But for the clarity, we have to do the CT scan. So they did the CT scan right at that moment.
This is all in Australia.
Everything is on Australia.
Where in Australia this place? This is in which city?
In the Sydney. It's the capital of New South Wales.
Okay, New South Wales. So during your pregnancy, you were detected to have diabetes.
Just the diabetes.
Gestational
which
diabetes.
Is normally the ladies going
Ladies
to
will get it.
Yeah.
And you were requiring insulin for it.
Insulin.
And when your doctor saw you, she ordered some blood tests.
Blood test.
On those blood tests, they found that there was some abnormality in your liver function.
In the
test.
liver, yeah.
And then to check the status of your liver, they advised for an ultrasound. Ultrasound abdomen, and on that scan, they found that there are some stones, but the ultrasonologist was not really sure if the stones were inside the pancreas or if they were inside the gallbladder. And so he suggested that you go ahead and do a CT scan of your tummy. So you got the CT scan done?
Then on the same day, I had the CT scan done, and then after a few days, they sent me the CT scan report. And I was reading that, but I'm not a medical expert, but I don't know what is the chronic pancreatitis. So I went on the internet and did some research, and then after I discussed with my husband, and he said that we need to go to some specialist. Then we go to a very well-known, renowned specialist there in the North Shore Sydney Hospital. His name, I don't want to mention. And then he advised me some further tests like the MRI and the endoscopy. And when the MRI report comes, he called me back and he said that, look, there is some stones on your pancreas head as well as on the tail. But the bad thing is that your stones are also in the pancreatic duct. So I can take the stones from the head, but not from the pancreatic duct, because I don't have because this is not possible. He didn't say that he does not have the skill, but he said it's not possible. Okay, so the only way is to do that, we take the whole open surgery and we take the whole pancreas out along with the spleen, and that procedure would be 13 hours long.
Oh my God.
And the operation itself is a very complicated operation. Okay, he said that, but besides that, he said that if you're not going to do this, you will get a pancreatic cancer in coming 5 years. And you have to go for the 6-month MRI every time. 6 months MRI every time you have to do, and you have to observe yourself.
So this must have come as a big shock to you.
And when my husband listened the cancer name, he was like 50% agree to him. Oh, you will get the cancer, you do this operation. But I was not agree. I have to discuss.
From what I understood, she went to a very big, renowned doctor in Australia, in Sydney, who saw her reports, the CT scan report, the MRCP report, the endoscopy, and she was told that she has chronic pancreatitis. She has multiple stones in the head of the pancreas, in the tail of the pancreas, in the pancreatic duct. She was told that without a major surgery, these stones cannot be removed, and the major surgery, the 13-hour operation that was suggested to her, was complete removal of the pancreas, removal of the spleen, and she was told that if she does not undergo this surgery, she is going to develop pancreatic cancer. This
you
what
mention
happened.
about
Yes.
And I want to mention another doctor. He was also from the North Shore Sydney Hospital, and very surprisingly, he was the director of endoscopy. He himself conducted my endoscopy test. And when I was in the recovery room after the endoscopy, he came to me. I don't know what happened to him. Probably he has mixed the report. I'm not sure. But I'm just telling what he has conveyed to me. He said to me, you have no hope. This is the sentence he has mentioned to me. Like, how cruelly you can mention this to a patient laying on the bed. And your pancreas is totally scarred. Even your bile duct is closed. But you can see my bile duct is not even closed, not even have any
So
problem.
then what happened? So when you heard all these, this grim news, this sad news, this scary news,
And then there is another surgeon as well. We went to some other doctor,
okay,
and that is to the Royal Prince Alfred Hospital.
okay,
I'm working in the University of Sydney as a researcher, so that hospital is associated with that. That doctor was comparatively honest compared to the first two, and he said that look, in the Australia there is no treatment for that.
in Australia there is no
He
treatment
was
for chronic
at least
pancreatitis.
honest. He was saying that mostly this disease is happening to the patient who is having the alcohol consumptions too much, so we are not interested to help them.
So he said that in entire Australia
Yeah.
there is no good treatment for.
So he said at least I can do that. I can do the ERCP and took your headstones out.
Okay, but we'll not be able to get
We'll
the
not.
stone, the tail of the pancreas. So then, how did you manage to find us? Because you are in Australia, we are in New Delhi, India. Then how were you able to find us?
So you can imagine my the little child was only 4 to 5 months. I was in a very bad state. I can't tell you. I was in very bad state. Every time I was just searching on the internet about the surgeons, about the doctor, about the chronic pancreatitis. So one day, a miracle happened. It's it's literally just not the video, but it's just a miracle happened in my life, because probably I have to live a bit more longer. So I found him. Seriously, I found him. I came here and everything went so smoothly. He's so skillful. He's brilliant. In simple words, I want to say that he's simply the best in the world.
We're so happy with the
We're so
operation.
happy. And it is not I had the surgery, this is my 4th day. I came down from my room by myself, walking down by myself. I'm not feeling any kind of pain. And I'm very much happy.
So she has undergone a laparoscopic surgery for chronic pancreatitis. So what we do in this laparoscopic surgery is that we open the duct of the pancreas. We remove the stones, all the stones inside the pancreatic duct, whether the stones are present in the pancreatic tail, whether the stones are present in the pancreatic body, whether the stones are present in the pancreatic head. We remove all these stones, and then we join the pancreatic duct to the intestines to ensure that the pancreatic juice can flow smoothly from the pancreas into the intestines. So because the surgery is done by the laparoscopic technique, by the minimally invasive keyhole technique, that is why the recovery is so fast. She is just 4th day out of her surgery, and if you look at her, pancreatic surgery is a big surgery. It's not a minor surgery, it's a major surgery. But you look at her and then you would say that I will not believe that she's undergone a surgery, such a major surgery. When do you plan to travel back to your country?
In 2 days.
2 days?
On Monday, I have a flight.
So you will be flying back to
Flying
Australia
back to my parents.
after 2 days. And happy and excited.
I am happy, very happy.
Right?
I cannot explain in my words.
Thank you. And what about you? You are her friend. You want to tell your
yes,
experience?
I'm super happy with the service. Everything is so professional. The hospital is clean. We got a beautiful room, ample room. I got a comfortable couch to sleep next to her, and the service was fantastic. We are provided with good food, good healthy food. So prior to coming to hospital, we were living outside in hotel, and I got a tummy bug, Delhi, as they say. So I was very scared of eating food outside, and I stopped eating, and I was just drinking teas. And when I came to the hospital, I was served with a really good, healthy meal, and I was so happy that the food is clean. And one thing I would like to mention is that all the international patients, they get a representative, and our representative was Akif, and he's such a friendly boy, and he assisted us with everything, taking us to all the tests, where to go, showing us our rooms, and assisting us in every step. So we didn't have to struggle finding things on our own. So we are very happy, and I would really recommend this
I would
place.
highly recommend this place, highly. Just come to Dr. Amit Javed if you have any problem regarding abdominal issues and like that. Highly recommended.
So friends, you heard the experience of their surgery for chronic pancreatitis. So people out there, you may be in different parts of the world, you may be in India or you may be abroad. We work in Fortis Hospital, which is a multi-speciality tertiary care hospital in New Delhi, India. And we perform all complex surgeries for pancreas and other organs also. We do advanced laparoscopic surgeries for chronic pancreatitis, acute pancreatitis, even laparoscopic surgeries for diseases like pancreatic cancer. So if you are suffering from any of these diseases, if you would like to consult with us, you can share your reports at the number mentioned below on the screen. And whatever is best possible for you, whatever is the best possible solution to your problem, we will help you get that.